ReachMD XM157 presents a special series, Insights in Future Medicine.
Those of us old enough to remember Stanley Kubrick's blockbuster movie 2001, A Space Odyssey, are likely to be at least a little concerned about the growth of the electronic medical record. In the movie, the spaceship's computer ran amok and started killing off the astronauts one by one. Salvation could only be achieved by unplugging the machine. Is this cautionary tale an allegory for our times? What does the future hold for the EMR? You are listening to ReachMD XM157, the channel for medical professionals. I'm your host, Dr. Michael Benson. Our guest today is Justin Barnes, a senior executive of Greenway Medical Technologies, one of hundreds of companies rushing to fill the need for practical electronic medical record. Justin, what is the current market share of the electronic medical record in hospitals, and then, if you could be so kind, in physician offices?
Well, they actually hover probably around the same. The adoption of electronic health record, the care providers actually entering in data at the point of care in both sectors probably hovers around between 10 and 20%, depending upon how you want to classify adoption and what types of technology you want to put into that survey. But between 10 and 20% in the ambulatory and the inpatient setting.
So right now it's a relatively small minority.
Yes, most certainly.
And what is the estimated market in dollar terms for the EMR? I'm not sure which market you want to refer to, whether it's a hospital, the private practice, or both, but can you give us an estimated dollar value?
Yeah, it's probably, people calculate it probably a little bit differently, but it's well over a $1 to $2 billion industry just in the next 12 months and growing.
What is the estimated total industry value? That is, when everybody's on the electronic medical record. Any estimates for what the industry will reach then?
I would say between $10 and $15 billion in the next 5 to 7 years minimum.
So for you investors out there, this might be a smart time to move. Actually, this is certainly not a financial program, so I'm not giving any financial advice. So how do you see the trends over time? How quickly is the EMR entering the marketplace, both in the hospital setting and the physician office setting?
Well, today it's moving faster than ever before. We've spent a lot of time since really 2004 putting a lot of the foundations in place. We are working to certify electronic health records to give them kind of the good housekeeping seal of approval. We are working on interoperability standards. That just means that standards in healthcare systems that allow us to share medical information when we want to share it and to share it with entities that we want to share it with. And then trying to align the incentives to increase healthcare information technology adoption. Naturally, there's a lot of ROI that comes with the adoption of electronic health records for the provider, but there's also a lot of ROI to the payers, whether private payers or public payers, for the adoption of HIT, and for the insurance carriers for that matter. So everybody needs to put a little stake in the game and work their components for the adoption of the electronic health record in HIT in general. So we see a lot of those aspects coming together. Certainly in 2007 we saw it, and we see even more in 2008. So whereas only 10 to 20% of physicians have adopted today, you're going to see 80 to 90% adoption over the next 5 to 7 years, certainly. So a lot of growth coming up, certainly as we align more of these initiatives. We still have a lot of work cut out for us on the privacy and security side, but we've covered a lot of ground in the last 2.5 years to allow for a great base to build from and a future of success in this.
So one take-home message is that it's estimated that perhaps 80% of physicians will be using some sort of electronic medical record in 5 years from now. Is that correct?
I would say if we continue on achieving our goals, most certainly yes.
And what about the hospitals? Would you say the same is true for the hospitals?
Yes. The hospital-based systems are working fast and furious to build their systems for physician order entry, but then also just the physician document at the point of care with the patients. So same thing that we're doing in the ambulatory setting, they're trying to do in the acute care setting, yes.
What changes and innovations do you see coming down the road in the medium-term future, over the next 5 years perhaps, for the electronic medical record? Are there some things that will be available, some features or capabilities that we don't see quite yet?
Yeah, I think that you're going to see the biggest change that you will see is access to information that really is siloed today or regionalized and information that's not shared. So you're going to have access through your electronic health record. You're going to have access to more information on the patient that you're seeing, more clinical education, more best practices, and you're going to have more incentives for the use of your electronic health record. We're also going to have patients as part of this equation. Beyond just having them come in and fill out paper forms, they're going to be engaged with your practice. They're going to be more viewed as consumers than patients. Every day, patients pay more and more of their own health care. And so they're going to come into this equation in more of a consumer-centric role where they're saving and investing in their own health care. Now, hopefully that will also have other ramifications where they start taking better care of themselves and exercising more, eating, more healthy. But that also is going to change the dynamic of the physician-patient encounter, because you will be managing, instead of care for just that patient, I think that primary care providers and others are going to see more of the opening of managing the entire family's health care. And I think those kind of aspects are all going to make their way into the medical record. It's going to be, the electronic health record for the physician, the personal health record for the patient and for the family. And I think the care provider at the end of the day is going to have a lot more information to work with, make more informed decisions, and also have access to more best practices. So they don't have to go off on their own so much. They can rely on more peer information, peer education, and then also put their own aspects into it as well.
If you have just joined us, you are listening to ReachMD, XM 157, the channel for medical professionals. I'm your host, Dr. Michael Benson, and my guest is Justin Barnes, Senior Executive for Greenway Medical Technology. Greenway produces an electronic medical record for physicians' offices. We're discussing the future of healthcare information technology industry. So what about voice recognition and dictation? Is that going to come down the pike in the next 5 years?
Sure. A lot of systems today allow for both of those modalities inside their electronic health records. But if the system really has been tuned and customized for the care provider, those modalities may not be used as much. What we've tried to do a lot of with a workflow inside of some of the leading systems are really to have that, the way they would access paper charts in the past. Well, we have this built in through a templating system within the electronic health record. So if they want to use voice dictation, they most certainly can, and it's captured as a WAV file. And then, as we get even more technologically advanced, that WAV file can be turned into discrete data. But we really need all information stored as discrete data. That goes back to the importance of relational databases and practices having access to all information stored discretely, so when they want to create reports, that those reports can be generated. Reports and outcomes are really the future of medicine, and that's where electronic medical records come from. We can't really query paper records too well through a search engine, but we can query electronic medical records very well with search engines, certainly within search engines within the individual systems. So voice dictation and transcription and all that is going to be incorporated better into electronic health records. But hopefully when a physician or a clinician or care provider rolls out an electronic health record, it's really customized to their workflow, templated to their workflow, so they're only touching the screen of their tablet PC that they're carrying around. And by doing that, that system's calculating all that discrete data, and nobody needs to go back in and listen to any transcription or anything like that. Our system specifically does eliminate a lot of transcription, and we ensure that care provider can finish that care episode as quickly as possible and move on to new patients and new work that needs to be done.
Well, as we talk about the future of the industry, how many companies are in the industry now? Is there any estimate of how many companies have producing software for the healthcare industry for the electronic medical record?
Sure, great question. There are over 200 that produce software for our industry today. However, we have recently created the Certification Commission for Healthcare Information Technology, and in 2006 we rolled out the very first certification effort, and 80 or 92 products were certified at that point under last year 2006 certification. And in 2007 there are 10 companies that have been certified. And we really do recommend that physicians look for that CCHIT seal for 2007, because that means it's the latest, it's passed the latest round of testing, and that company really is committed to the future of medicine. So that certification limits it down to about 10 companies, and any one of those 10 companies, then you look for ensuring the company is very well deployed in your specialty, that it's meant for your practice size, and you've gone through the purchasing requirements and making sure that you've met with the executives from that company, that you really are buying from a company that you like, and that they're going to be around in your specialty and that they're committed to your specialty. Because no one EMR or EHR is good for all medical specialties. They all do focus somewhat. Some can cover up to 30 or 35 specialties and subspecialties, but some cannot. So it's very important for the physicians and the care providers to really research those solutions and make sure they're purchasing the right one, and the right one that has that certification seal on it.
Well, with 200 companies today, how many will there be in 5 years? There has to be some chatter in the industry about how many will be surviving.
We've certainly batted that around a little bit, and I would say you'll probably have, because even with 2008 certification, that raised the bar even higher. But we will always expect you'll have between 10 and 20 companies that will always pass certification in a given year. It could be as low as 5 to 10, but there's companies that are being created just based on the requirements for certification. So we've seen a few companies emerge in the last couple of years. Now, those probably don't have all the workflow that you need in a practice, but they have the functionality. Workflow is actually more important than functionality, because even if you have all the bells and whistles, if the physician and care providers can't use it at the point of care, the product's useless. So workflow is most important. Then number 2 is all the functionality that comes in behind it.
For those 80 to 90% of physicians who don't have an EMR in their office right now, how much money should they set aside in their piggy bank to purchase and implement an EMR? What is a typical cost of implementation per physician for like a small group of perhaps 3 physicians?
A standard electronic health record could cost you anywhere between $10,000 and $20,000 per physician, and that's for a full system. That's for a full electronic health record and a fully integrated practice management system, and with all the interoperability components that you're going to need to exchange healthcare information. But very important in that equation is the return on investment. So you get a significant uptick through the reduction of transcription, because with most leading systems, you're going to do away with 90% of the transcription costs. So once you do away with that every month, and then you capture all the care calculations and you're documenting at the point of care with your patients, capturing all those charges, you will see your return on investment go dramatically up. And those systems can be completely paid for in maybe 16 to 18 months. And then at that point, you've increased profit by anywhere from $22,000 to $80,000 per physician per year. So it's pretty significant return on investment. But it could cost up to $15,000 to $20,000 per care provider in the initial stages. But like I said, once the return on investment kicks in, it becomes profit very quickly.
I want to thank Justin Barnes, one of the senior executives from Greenway Medical Technologies, who has been our guest. I'm your host, Dr. Michael Benson. You have been listening to the Clinicians Roundtable on ReachMD XM 157, the channel for medical professionals. We would really like to hear from you. For comments and questions about this program or suggestions for other shows, send your email to xm@reachmd.com. Please visit us at reachmd.com. Our new on-demand and podcast features will allow you to access our entire program library. Be safe. Be informed. Thank you for listening.
Thank you for listening to a special series, Insights in Future Medicine on ReachMD XM 157, the channel for medical professionals.